Yes, well, thank you, Matt. It's great to be back on our regular time and day. If we could spotlight the ASL interpreters as we start. There we go. That was an instant response, nicely done. We're going to just give you an update today on what's going on with COVID in the state, as we usually do, with a couple different angles of the data and some national data as well. So with that, I think we could get the first slide. This is an update today from today's epidemiology report. There are 959 cases, and if that makes you nervous to see that number be that high, then it makes us nervous as well. It's a high number. Unfortunately, I know I'm getting a message that my audio is uneven, and so I will do my best to do what I can do here, but it's based on my internet connection, unfortunately, and it has been a little troublesome today. So in any case, you can see 389 people in the hospital. That's trending upwards. 15 deaths, sadly, to report today. Any death, of course, is one that we regret and mourn as a state. There's always a family and often children and brothers and sisters and even parents involved. And so, and we have also passed the 5,000 number of people all covered by our media partners over the past couple of days. You can see the total number of cases there, the total number of hospitalizations. It's interesting, we're now up to 13% of our population who's had an active COVID infection that we're aware of with a positive test. We have about 6.6% of people, which is about 1 in 15. Out of every 15 people that has a COVID infection will end up in the hospital. And then about 1.8% of everyone who gets COVID will die, sadly, from this fatal disease in some people. And then just to combine those last two numbers, if you are hospitalized, we're seeing about 19% of people who are hospitalized with COVID actually not leaving the hospital alive. So in any case, we're pleased with the fact that we're all back here together today. And I don't often say it enough, but if I could pick any two people to be here to update New Mexico and what's going on with COVID, it would be Aaron and Christine Ross. And with that, I'm going to turn this over to Laura to give us an update on vaccination.
Hi, everybody. Thanks so much for having us again today. And I'm excited to report out that we continue to slowly increase our vaccination rate, which is very important given what David just shared. Unfortunately, there's still COVID cases because there's still a percentage of people not vaccinated, but the exciting part is 72.3% of New Mexicans are vaccinated who are 18 and over, fully vaccinated. 54.2% of New Mexicans 12 to 17-year-olds also fully vaccinated. Partially vaccinated people, 81.9% of New Mexicans 18 and over, and 62.4% of New Mexicans 12 to 17. That's really exciting. Thanks again, New Mexico, for all the great work you're doing to keep our community safe. And then 8.2% of New Mexicans 18 and over have received a booster dose. So you can see that in New Mexico, it's not even throughout the state. And we just continue to encourage people to talk to their trusted people in their communities to try to get more information about getting vaccinated. Next slide. These are the weekly vaccine doses administered since December 24th. And so as you can see, we are at a steady curve up and just kind of flattening a little bit. So like I said, slowly but steadily, we're getting more and more people vaccinated. Next slide. One of our big concerns is the gap for racial and ethnic equity. So you can see that Hispanic and Latino population 16 and older, 49.7% of people are vaccinated. So there's a gap still between people who are Hispanic, Latino populations and also our African American populations at 51.9%. but also some of our white populations at 65.1%. So just trying to keep an eye out on, making sure that people who are vulnerable, we're reaching out to them. I know so many of you are reaching out to your community members, so many pharmacies and providers and community organizations, and even our own public health department really reaching out, trying to get, people the information and knowledge that they need. Next slide. So we have some really good updates for everybody today, and one of them is the 5 to 11-year-old vaccine approval progress. Next slide. The FDA committee actually approved the Pfizer vaccine for 5 to 11-year-olds, and CDC guidance is likely to be coming next week. So that's really exciting for kids. The panel members voted 17-0 to recommend the shot, which is really great. It's 2 doses, 3 weeks apart. And here's the CDC pediatrician who said, to me, the benefit is clear. We don't want children to be dying of COVID, even if it's far fewer children than adults. So this is very, very exciting for us to vaccinate another group of people who have previously been unvaccinated. Next slide. Here's the process for the 5 to 11-year-old vaccine approval. So we are just completed step 1. So that's reviewing all the FDA committee that looks at all the scientific evidence to see how safe it is. And like I said, they deemed it safe. The review and final approval by the FDA is within the next week. Then it'll be reviewed by the Advisory Committee on Immunization Practices called ACIP. And then after that, CDC will give the final guidance, and we'll get the review and approval by our New Mexico Medical Advisory Team. And early November, we'll be able to get our 5 to 11-year-olds vaccinated. So that's super excited for all those parents out there who are waiting for their kids to get their vaccine. Next slide. Our team has been working really hard. There's a whole vaccine team at the Department of Health working with providers and people all across the state. And our new electronic consent form for child vaccination is now available at vaccinenewmexico.org/kids. So if you're a parent or a guardian, you can actually now link your child's profile to your own profile and manage it for your child on their own behalf. So you can update your profile information, schedule your appointments, and also complete the parental consent forms. So that's exciting for all of you. This is how you link. There's instructions on how to link your dependents or children to your profile at vaccinenewmexico.org/kids. So you can start doing that now. As soon as you see the show, you can do that. Next slide. Booster doses are actually now available for all 3 COVID-19 vaccines. And so for the Pfizer and Moderna, so Pfizer was approved last month, Moderna booster vaccines are now approved, and eligible New Mexicans include people who are 65 and older, the same group as Pfizer, 18 and older who live in long-term care settings, 18 and over who have underlying medical conditions, or who work or live in high-risk settings, and it's 6 months or more after the completion of your initial series. So just, we think that everybody who's in these categories should go get boosted, but if you're 65 and older, because of your risk for getting sicker, if you're 65 and older, we're really encouraging that group to really go get vaccinated. The Moderna boosters are half a dose, just so you know, but people who are immunocompromised, so remember that group way back when in August, people who are immunocompromised receiving a 3rd shot for additional immunity will continue to receive a full dose. Next slide. So the next slide is also exciting for those of you who got J&J. The J&J booster vaccine is anyone 18 and older, and basically you can get it 2 months or more after receiving a single dose of primary vaccination. And next slide, this is more information, and I think just one thing we just want to thank New Mexicans for your patience as the science develops and we get more and more information. You have more opportunities to get different kinds of boosters. So the boosters you can now mix and match. It's really your preference. The CDC and the FDA approved mixing and matching, which means that if you got a Pfizer or Moderna for your primary dose, you can now get any booster at 6 months. So part of it is just your preference, because they've shown that you can mix and match and still get a boosted immunity. And also, if, let's say you forgot your card and you're like, I can't remember if I got Pfizer or Moderna, you can just go get any dose. If you did get J&J as your primary, you can also get any other boosters at 2 months. So basically, let's say I got J&J, I can decide to get a Pfizer or Moderna 2 months later, or if I got a Pfizer or Moderna, I can decide to get J&J, Pfizer, or Moderna at 6 months. So a lot of options for people. In terms of our booster dose administration progress, you can see that booster doses are steadily increasing. We now have 125,843 total booster doses administered since August 1st. So good job, everybody in the community, for vaccinating people and for everybody going out to get your booster doses. Next slide. Once again, even though the booster doses are important for boosting your immunity, it's really, really important that those of you who haven't been vaccinated, like I said, talk to someone trusted. Full vaccination is still our first priority, because any of the vaccines that we have will really prevent against getting severe hospitalizations and death. And like David said, we don't want to lose any more family members, sisters, brothers, daughters, sons to COVID. Next slide. So you can make your vaccine appointment today, whether it's your first doses or your booster doses. You can get your COVID-19 appointments online at vaccinenewmexico.org. You can schedule an appointment with your primary care provider or a pharmacy. You can also get your flu shot at the same time. So that's great, because let's protect ourselves from all different illnesses. And then if you want to talk to your provider or someone trusted to have any questions about COVID vaccine or your eligibility for a booster dose, definitely do that. Next slide. We also have a call center. We really developed the call center as an equity issue for all the New Mexicans who don't have access to a website. So the call center purpose is really to support those people with scheduling online by phone. Option 3 or 9 takes callers directly to a Spanish speaker. And thanks to our call center, it's open 8 a.m. to 8 p.m. Mondays through Sunday, every day of the week. So thanks for the call center for doing that. Next slide. And then I want to pass it over to my amazing colleague, Dr. Christine Ross. So thank you.
Thank you, Dr. Petahone. And I want to just make sure that you can hear me okay, and then I'll get started.
We can hear you.
Okay, getting the thumbs up. So thank you for having me here today. I wish I had better news to share. So let's just go ahead and launch in. We're going to start with COVID-19 global situation update. As we all are well aware, the world continues to grapple with this global pandemic. This slide has data on it from the WHO, or the World Health Organization COVID-19 data dashboard. Globally, there has been over 243 million cases of COVID-19 confirmed and reported, and over 4.9 million deaths. I think these are just staggering statistics. On the far right-hand side of this slide, you can see cases. This is trending out, the cases on top and the deaths on the bottom. And you can see that globally, we were beginning to see a nice downward trend there in confirmed cases, and it seems to have plateaued. Down on the bottom of this slide, they're breaking down these cases by WHO region. And I'm going to point out a few things about this on the next slide. So we can go ahead and go forward. So here we're just going to zone in on the region of the Americas, which obviously the United States is part of the region of the Americas. This is in the gold color at top, on the top here on the right. And as you can see, what's nice is that we are seeing in the Americas a downward trend over time. A very much welcome downward trend in our region of the world. But I think what's very interesting is that the converse of this is happening in the region of Europe, where you see an increasing trend starting to emerge. What I understand is that Eastern Europe is accounting for a substantial number of these cases. Places like the Federation of Russia, which has a very much smaller proportion of their citizens vaccinated than we do here in the United States. But notably, there's also a surge being seen in the United Kingdom, which unfortunately very similar case trends that they had seen earlier in the summer when they first were dealing with the Delta variant. But the one take-home message, though, I want to share is that when you unpack this a little bit, you see this alarming rise in cases in the United Kingdom. But what you don't see is a similar rise in hospitalizations and deaths. And so very different from what they had seen in prior surges, and most certainly is related to their high vaccine uptake throughout the United Kingdom. So let's go ahead and move on. So from globally, we're going to talk a little bit about the national situation. This is a really busy slide, but I just want to start with the numbers like we did globally. So over 45 million total cases have been reported in the United States, and over 736,000 deaths. Again, these numbers are staggering, and just it's a very unbelievable public health crisis that we've been dealing with. What I wanted to show here is that, when you look underneath the overall national trend, this is a large country, and we see peaks and troughs of activity that hit different parts of the country at different times. I don't personally believe that these patterns are easily teased apart and that we can say this is related to seasonality or XYZ. I think it's quite a complicated pattern. And I think it's just important to understand overall in the United States, we are beginning to see this much welcome decrease in viral activity and new cases. And so this is displayed on this graph on the right hand of the slide. This is the daily trend in COVID-19 cases in the United States reported to CDC. And again, you see this nice downward trend. And then we're also beginning to see a downward trend in the 7-day moving average of deaths. Most notably, I would just want to mention Alaska has really been hit hard. They continue to be hit hard, though. I believe the latest update I heard is that they're beginning to see a slight a trend in the right direction. Up in the Northwest, they also had been hit quite hard, but I understand that they're beginning to trend down as well. And other parts of the United States that were hit very hard over the past 1 to 2 months as they grappled with Delta surges have now begun to see a real reprieve. Here in New Mexico, we continue to sit at an uncomfortable plateau, and I think we can go to the next slide and we'll talk about that a little bit. So this is our statewide epi curve where we plot the number of new cases. These are plotted by the date we receive or the date the specimen was collected from a patient or client or person. And we plot these out over time. And what you see, the big mountain in the middle of the slide, is our very large winter surge that we grappled with. This is pre-Delta, but this was also prior to our massive vaccine rollout efforts. And so what you see here on the right-hand slide is certainly this is fueled by Delta, and we've talked about this, I think, week in and week out, that this has been fueled by this highly infectious variant of the SARS-CoV-2 virus called the Delta variant. And we saw this peak and began to see a decline. We were very happy that we obviously had flattened out this curve. And what I mean by that is we don't see the large numbers that we saw back in the winter. So we clearly flattened this curve, but it is not trending down as we would like to see it. We are sitting on this very uncomfortable plateau, which is highly impacting our healthcare delivery system and all of us here in New Mexico. And Secretary Scrace will provide more information about this when he speaks to you all. Next few slides, I think we're going to go into what's happening regionally. So we take that statewide epi curve and then we break it down by region of the state, and we're tracking new cases by region. This is the metro region, obviously the most populous region, and so it really drives a lot of what we see across the state as far as the trends. And as you can see here, metro region sitting at a uncomfortably high plateau. We want to see this trend back down to where we had seen, where we were sitting back in June prior to Delta. So let's go to the next slide. These are some regional slides that we wanted to point out that we find are worrisome. Here on the left-hand part of the slide, you'll see the Northwest region. And unlike the metro, which is sitting at this high-level plateau, we actually see an increasing 7-day moving average for the Northwest region, which is very, very concerning. Over on the right-hand side is the Southwest region, where we are also seeing a high plateau, and then what looks like even an increase is being seen in that region. So we're providing this so we can share situational awareness so that people understand what's happening in the region where they live. Next slide. This is pointing out the Northeast and the Southeast. The Northeast, I think this is still worrisome. We did see a downward trend, but then we're sitting at a bit of a plateau. The Southeast had an unusual pattern from the other regions where we saw a very steep rise in the 7-day moving average of cases, and then a very sharp decline. So different from what we've seen in other regions, and we certainly want to zone in that this is a welcome reprieve that people are seeing in the Southeast, and we hope that this continues to trend down to pre-Delta levels. Next slide. Okay, and this I think everyone's familiar with. This is our map and table where we combine the case rate, or what we look at, cases per 100,000 people, and then we combine that with the test percent positivity, or out of all the people who go out and get a test in a specific county, how many are testing positive. And unfortunately, you see here that all of New Mexico is in a sea of red. Red is indicative of a high level of community transmission. So what does this mean? This means that we don't see COVID-19 cases confined to a specific location, or rather setting or place, or a specific group of people. In other words, there's a high level of community transmission, and people are getting infected in many different types of scenarios. And so one thing that we put into effect is we're asking everybody to mask when you're indoors. This is really important when you have this high level of circulation of the virus. this is that when we're indoors in public, that we are masking. We also know that we have to continue to be vigilant, especially with numbers like this. And this means avoiding crowds, trying to take activities outdoors instead of indoors. Make sure you're wearing a well-fitted mask. And then, of course, anyone who's eligible, please seek out a vaccine if you have not been vaccinated, and then please seek out a booster shot if you're eligible. And then next slide. I believe this is my last slide. And this is a graphic from a recent MMWR, which is the name of a CDC publication. New Mexico was one of 13 jurisdictions that contributed data to this publication and this study. And what does it tell us? It's this really important information. So we looked at incidents of SARS-CoV-2 or COVID-19 infection, hospitalization, and death among those vaccinated, and we compared that to those unvaccinated. And so, two important take-home messages: you can vastly reduce your risk of infection, hospitalization, and death by getting vaccinated. So 5 times reduction in risk of infection, 10 times reduction of risk in hospitalization, 10 times reduction of risk for death among those vaccinated. The other take-home message is that this looked at after Delta became the most common variant. And so what it showed is that our vaccines remain highly effective against the Delta variant. I believe that may be my last slide, and I can turn this over now to Secretary Scrace.
Thank you so much, Laura. Thank you so much, Christine. And I'm going to try to finish this off here and talk a little bit more about our hospitalizations and death statistics. We got a great question from Scott Weiland from the Santa Fe, New Mexico, about why are we on this little saddle here. And when I talk about hospitalizations, I can talk about it there just as well as anywhere else. So let's move on to the next slide, Brianna. And this is the hospitalization data since about July 1st. And you can see we've gone back up. We had that promising downward trend. We've leveled off, and frankly, we're now going up again. Remember, we have a gray bar here saying don't look at the most recent data since that's still coming in. But we actually have an upward trend, in that 900 and some cases that you saw earlier goes along with that as well. We spent almost the whole modeling team meeting yesterday talking about this plateau, what's going on, why are we seeing this? You know, we're not entirely sure, but we came up with a long list of possible reasons why we're not seeing the cases just go up and come back down. But nobody was really convinced that any of them were the reason, and perhaps it could be a lot of different things. The real problem is that despite our calling of crisis standards of care, which was more of a acknowledgement of what was really going on in the hospitals, we're seeing this upward trend again in hospitalizations. One question is, well, how come we keep having COVID hospitalizations exceed our normal hospitalization capacity? Another great question, Scott. And the reason is right now we have a lot of people in the hospital, way more than last year at this time, with non-COVID illnesses. And our hospital leadership and physicians and others around the state are fairly convinced, although we don't have good data, that the folks who are in the hospital now are primarily there due to much worse complications of illnesses as a result of not getting regular care during the pandemic. And so it isn't that the COVID hospitalizations are higher than last time. It's not the case. As they back in hospitals are nonetheless full with what they can verify as the sickest patients they've ever had. Next slide, please. This is our modeling from Presbyterian. We looked at the other day The good news is on the bottom, if you can point to that, Brianna, it looks like we're going to see a stable number of ICU admissions. Now, our ICUs are completely full. And Brianna, I don't think your cursor is really moving or big enough for people to see. And then, oh, there we go. And then, however, on the blue one above, that's the general medical surgical beds. And we are seeing a further projected uptick in those hospitalizations and bed use for COVID patients, which of course is alarming. We're already in crisis standards of care. And now it looks like hospital utilization is going up. That's reflected also in the next slide, which is our weekly scoring of how our hospitals are doing. We're well up into the crisis standards of care range. As you all know, we declared that, issued public health orders almost 10 days ago. And so watching things very, very closely, working with our hospitals to try to manage these volumes. The next slide. And just the count, 20 available ICU beds. Again, very few in Albuquerque. You can see there a few in rural areas. I know earlier this week we were making arrangements and did actually offload and overload patient farms all the way down to Las Cruces, some to Albuquerque, but some to Las Cruces. So that's a really long way to move a very sick ICU patient just to make room. But we continue to function as one giant delivery system, equalizing the ICU volumes. And the team is working very hard, very well together. You can see we have 93 available. And that's going to come in handy as if the modeling that we saw previous slide from Presbyterian turns out to be true, and we have a further increase in the number of people in our hospitals here in New Mexico. Next slide. I wanted to talk about some things we can do to help our hospitals. FEMA is the federal emergency management group that deals with tornadoes and hurricanes and other things, but they're also have been a great partner of the state during this pandemic and have provided us a lot of different resources when we need them. We did have them come in and do an assessment because we were pretty urgently in need of additional help. This happened at the end of September, and they really did confirm that the number one, that transfer system that we use that we've told you about is a national kind of best practice. They haven't seen any state as coordinated as we are. Second, they found really that all of the facilities in the state really are at their maximum capacity. We knew that already. Staffing was the limiting factor. We knew that. They, at the time, at the end of September, did not have assets available, although we're re-petitioning them this week. In addition, we have a contract that's been executed with a staffing firm, and we're looking to bring in 290 medical support staff, most of these nurses, to a number of places in the state. We know that they're in a pretty desperate situation in Farmington, also down in Alamogordo, and so we're trying to direct resources there. And these resources are paid for by the federal government, so we're pleased. Also, we're not relocating people from New Mexico. This is getting resources from outside of New Mexico to come in. So that's starting to pick up right now, and our contractors are working on that. The last thing is that FEMA will pay both for-profit higher nursing costs to bring in traveling nurses. So we continue to work to connect our hospitals with FEMA. The process is a little bit complicated, but again, it's free federal support for these efforts. And so we're working with our hospitals to go through that process as well. Next slide. These are coming through kind of in slow motion. I'm not sure if it's your end, Brianna, or my end, but this will become a graph. Here we go, of hospital employee vaccination rates. And you can see that with the mandate in late August, the green are people who are already fully vaccinated. The blue is people partially vaccinated. The red are individuals who are just unvaccinated. And then the orange is the unvaccinated with an exemption. And you can see we've done really well with our hospitals in the state, and only 2.1% need the rest of their vaccination, and only 0.6% who remain vaccinated. The department has sent letters of warning and things like that. And in many cases, the unvaccinated, that red group, which you can't even see the bar on in the bar graph off to the right there, unless your vision is better than mine. These are employees who are just spending out their paid time off. None of them are having any contact with patients. And once they use up their time off, they can either come back fully vaccinated or they'll no longer have their job. Next slide. We also track nursing home vaccination rates. This is a little different because CMS is doing the data collection. So there's a lag in the data. And you can see, Brianna, I think I want the nursing home slide. And there we go. And are others having these slides come across very, very slowly, or is it just me? It might be me. I'm not hearing anybody say anything. But CMS collects the nursing facility data. CMS fines nursing homes $1,000. You can see that they don't have the unvaccinated with exemption there. These are percent diagrams. So sometimes the percents can actually get larger when less facilities report, but doing fairly well, almost 90% fully vaccinated, 4.2% partially vaccinated. And we're working with CMS on the exemption status of that 6.2%. And then finally is the assisted living facility employee vaccination rates. And those are on this next slide. Not as good progress in assisted living facilities. We have a bunch that aren't reporting, and the department has out warnings about that as well. But you can see that not over 90% of employees are fully vaccinated, 2.1%. So similar to nursing homes, and we do have exemption data here, and we are working with and regulating and finding those assisted living facilities. That's 6.6% where we have unvaccinated individuals, also the folks who are not reporting. So I think we're closing in. We're planning on going to a less frequent reporting schedule monthly, starting in November, and then we'll reevaluate after a couple of months, see how we're doing. Once you get over, well, like with hospitals, we're at 99.4%. There's no need to do the weekly reporting, but we'll continue provide this data for all of you. Next slide, please. And I'm just waiting for the slides to catch up. This could be some good news, and I personally think it's too early to tell, but my epidemiology team and Dr. Ross, whose opinion I often defer to on believe that those last 5 weeks, you see the numbers in the 40 deaths per week, may be an honest to goodness drop from when we were 69, 83, 73 cases. I certainly do hope so. I'm sure every New Mexican prays that we will see a drop in that death count, or at least hopes that. We did pass the 5,000 death mark on Monday, and you can see we have 5,012 deaths. I think 5,000 seems like a big number, but it's really a small number when you consider the potentially dozen or more close friends and family members of each person who dies in New Mexico. And on the next slide, there was some really nice coverage the other day from the Santa Fe New Mexican, again, about Mary Martinez, a Santa Fe resident who lost her husband and her father to COVID within a 4-day period in December last year. You can see her with her grand showing him the ashes of her husband and talking about the loss of her husband. Of course, there was not a vaccine available. It didn't come in time for them, but all of the loved ones. And you know, I thought it was very poignant when Mary said in the article that every time she sees anything about coronavirus, it brings back the memory of those two folks in her family she was so close to who passed within 4 days of each other. And she encourages everyone to get vaccinated and actually get booster shots as well when they're available. Okay, well, we're on the home stretch here, a few updates and reminders about things. Oh, wait, no, not quite on the home stretch. COVID-19 treatments, we're doing well. Again, next slide, please, Brianna. You can see that we're doing a great job. Regeneron is the treatment we give in the hospital, remdesivir, the treatment we give in the hospital, being highly utilized. Almost every New Mexico COVID patient who's admitted does get remdesivir, an effective treatment for moderately ill COVID infected individuals. And you can see I want a real strong shout out to our New Mexico hospitals and providers who every week for the past couple of weeks, past 3 weeks, set a new record in monoclonal antibody administration. Again, if you are positive for COVID with symptoms and you're over 64 or you're obese, or you have any one of the risk factors for serious COVID disease and hospitalization, please seek out treatment. You can lower your chances of being hospitalized by 3/4, 75%, which would really help our hospitals who already have more patients than they have beds for today. Next slide, please. I think we're featuring here, we had a whole bunch of hospitals who gave more than 30 doses. We're showing all of them to you here. Presbyterian reports as a system that's all over the state. And so we've got, 156 there. I won't read all the numbers, but we really appreciate Covenant, Gerald Champion, Gallup Indian Medical Center, Memorial Medical Center, that's in Las Cruces, and Eastern New Mexico Medical Center, who've really ramped up antibody treatments. And that's particularly noteworthy because these people are darn busy taking care of so many different patients and so many sick people in their hospitals. Next slide, please. I wanted to, just remind folks about the need to keep up that regular healthcare. We've talked today already about our hospitals are full, completely full of people who did delay medical care. You can see 41% of Americans have delayed medical care, including cancer screenings. October is Breast Cancer Awareness Month. So we wanted to remind all women about getting those regular mammograms. Before the pandemic, only 63% of women were up to date, and now it's even lower. And worldwide, breast cancer has now become the #1 cancer diagnosis worldwide. Used to be lung cancer. Next slide, please. Another reminder that a lot of our friends and neighbors still need help. This is just the count of unique customers in the Human Services Department. You can see back at the beginning of the pandemic, we had about 950,000, and that goes up and down, but we've increased our number of people that we're helping in New Mexico by, I think it's 167,500. And those choppy lines there on the right going up and down, the higher values are when we do give out PEBT benefits. That's the pandemic food benefit for students. So if kids are getting schooling at home, we actually pay for their meals at home like we pay for them in school. So still a lot of our neighbors and friends relying heavily on benefits. You can see some remarkable numbers that our SNAP program has provided money for 385 million, that's million meals to Mexicans this year. Medicaid covering 947,000 individuals. That's up by almost 100,000 since the beginning of the pandemic. And we continue to provide benefits for energy assistance, heating and cooling, and even income support and shelter when needed, and also ensuring child support payments. So there are still a lot of needy New Mexicans, and even though unemployment is slowly, progressively dropping, a lot of folks still need help. And while that's our job at the Human Services Department to make sure that everybody who qualifies for a benefit actually receives it, it's also all of our job as New Mexico to lend a helping hand and neighbors in need. And so I just want to highlight that today. The pandemic is going strong, and the economic situation that people are in also very much still affected for New Mexicans. In case you're wondering, that 1,112,495 people, unique people, is more than half of our population. Next slide. I did want to also just highlight one more thing, and this is a little bit of a preview of coming attractions. Kurt Steinhaus, our Secretary for Education, could be with us today. He's with the leadership of the Mescalero tribe, but DOH does have a $64 million grant from CDC to enhance testing in the schools. And the idea is with more testing, kids don't have to go home necessarily to be quarantined. They can quarantine in school. Now, when they go home, they have to be in quarantine. Right, so far, we're able to offer $70,000 to each school district, plus an additional $30 per enrolled student for this program. We've got about 2/3 of our school districts already on this. We encourage the rest of them to get on the program. And our goal, of course, is to get to 100% of school districts fully participating. But we in New Mexico are working with the CDC, along with Illinois, Kentucky, and Georgia to collect data for this program to keep our kids in school. Kurt, Secretary Steinhaus will be with us next week, and you'll hear more then. So this is just a little bit of a preview about what we're up to and some optimism we have about our ability to allow all of our kids more time in school in the safest possible way. And by in school, I mean in-person school, even though remote learning, of course, will continue. Next slide, please. And this is just a reminder, Delta is at least twice as infectious. We need to be at least twice as careful. I think Christine walked through those things that we all can be doing during a time of extreme risk and high spread of the virus for both vaccinated and unvaccinated people now becoming infected. Lots of protection against hospitalization and death for vaccinated people, but nonetheless, we still need to be careful, get tested, seek out treatment, keep that mask on indoors outside your own home, and then the usual guidance about hand washing, keeping things clean, wearing those masks, social distancing, getting vaccinated, and of course, getting that needed preventive health care. And that's it for the slides. We're going to turn them off now, and we're going to turn it back over, I believe, to Matt to sort of handle questions today.
Absolutely. Thanks so much, Dr. Scrace. And for those of you that have been with us before, you'll be familiar with the routine. For anybody that's new, here's how we like to do this portion of the press conference. Just use the raise your hand feature in Zoom, and I'll call on folks in order. And no need to collate a bunch of questions all at once. We'll go through the list of folks as many times as we need to ensure that everybody gets their questions answered. So please just do ask one question at a time. And when you get called on, please just say your name and your outlet as well. We will begin with Susan Bryan, followed by Julia Goldberg, followed by Gabrielle Burkhart. So Susan, you are unmuted. Feel free to ask your question.
Thanks for taking our questions today. This one might be for Dr. Scrace or Dr. Ross. We have a handful of New Mexico counties that have very high vaccination rates, like McKinley and Los Alamos. They're pretty way up there, almost about 90%. And yet community spread remains pretty high in these places. So can you tell us a little bit why that high vaccination rate isn't translating to the reductions in spread?
Yeah, I'm going to start, but Christine, please jump in after me. I think this is a lot of what we talked about at the modeling team on Tuesday. It was yesterday, actually. I kind of lose track of days sometimes during the more difficult parts of this pandemic. You know, there's a bunch of different theories. One is that the immune protection afforded by the original vaccine isn't quite as specific for Delta as it was for the previous variants. The other piece is, you know, New Mexico led the pack, the national pack, in getting people vaccinated. And the data about waning immunity or decline in antibodies means if we were first in getting everyone vaccinated, we may be first out in terms of that continued protection. So it underscores the importance of the booster shots, I think. And, you know, I've had my booster. I think actually all of us have had our boosters. And the reason I know that we've all had our boosters is because we're over 18 and we have an underlying condition, just to make that really clear. And, but I think, you know, I think we don't know everything, and that it's become a real challenge. I think I was thinking I was sort of bulletproof, you know, when I was vaccinated. I don't think that anymore. I got my booster as sort of my civic duty. I'm still being twice as careful. And then the last thing is Delta is just way, way more infectious than the previous strains. And so the chances of getting it, its ability to find a new person to infect is very efficient. The Delta variant has been a formidable foe. It's taken over 100% of all the different types of variants that we see. Usually through other peaks and troughs of other variants, they've been, you know, 50% or 40% or 70%. We haven't had anybody in, it's sort of like being at the top of the Billboard charts for a record number of weeks. Delta has really occupied all of the infections. And so hopefully I left a few other options for you, Christine, that might be going on, but what else do you have to say about it?
Yeah, I think you were pretty comprehensive there. I would add, you know, I think early on we spent a lot of time talking about, you know, what's this magic number we need to hit for herd immunity. And that number is elusive. I don't think we know what it is. And I think that obviously we haven't reached it. We continue to see that this virus can easily take hold in a community and spread very quickly. So I think that's number one. Number two is, I would say that this virus finds pockets of vulnerable people. And what I mean by vulnerable, I mean predominantly unvaccinated people, as our numbers clearly show. So again, it doesn't matter if you are residing in an area where maybe you have a higher relative vaccine coverage than another area. If there are pockets of unvaccinated people, this virus continues to find them. And that is what's fueling our numbers, as when we clearly show that when we break down cases, hospitalizations, and deaths by vaccine status. The other piece here, which Dr. Petahone has already addressed, and forgive me, I think Dr. Scrace, you also already mentioned, but that we clearly see that there is a waning immunity over time, and we began to see increasing number of breakthrough cases over time. And now we have the opportunity to get a booster shot rolled out. And so we're hoping we can motivate people, get them out, get them, first of all, if you're not vaccinated, to get vaccinated. And then second is to boost your level of protection and get out and get that booster shot. And then just the last thing, I don't know if you mentioned or not, Secretary Scrace, and I would say human behavior. We are tired. We're tired of this pandemic. It has gone on way too long, and people are living their lives. And part of that means getting together. And so there are gatherings and a lot more activities where people come together, and the virus finds opportunities to transmit from one person to another. So I would say that those things in a nutshell, I think is driving what we're seeing. I could go on and on, but let me pause there and see if that answered your question.
Great. I think we're covered, but Susan, by all means, feel free to ask a follow-up if you'd like to.
One more thing, Matt, just to summarize, I think there was a very, very strong correlation through the summer between high vaccination rates and low case rates, like very strong. And then when Delta came, that started to erode. And so because that happened at the same time that people were getting 6 months out for the vaccination, from their vaccination, it's really hard for us to know up and other states are down. And so I think in another 6 months, probably some clever scientists will have plotted all that out and we'll have better information, but we wish we knew that too. And that modeling team is like the smartest people I think in the world. And we're all, those folks are all like grasping at straws, like what is the correlation here that we can do something about to prevent case counts from continuing to rise and actually push it down. So for now, it's boosters, primary vaccine series, and new populations like kids next week getting started on their vaccines. Thanks.
Great, thanks everybody. Next we'll go to Julia Goldberg, followed by Gabrielle Burkhart, and then I'm going to ask a question that's in the chat on behalf of Michaela Helian. Michaela, if I'm pronouncing your name wrong, just let me know and I'll correct. Julia, you are unmuted.
Thank you, Matt. This is Julia Goldberg with the Santa Fe Reporter. Thanks for letting me ask a question. Earlier this week, New Mexico Voices for Children presented some data to the legislature's Health and Human Services Commission about the pandemic's impact on families of low-income residents and mostly non-white communities. A lot of it we've sort of heard in different forms from you, Dr. Patahon, and from all of you. But I guess it made me want to understand, based on that data and your own equity data tracking, how does that influence the outreach on vaccines for kids 5 through 11? Because I know you said that parents can update their own, their own registry, but if they are not vaccinated or they don't have access or they're part of some of these communities that are high in the social vulnerability index, it's not necessarily like enough to just say, now kids can get vaccinated. So I'm curious kind of how you're thinking about that, and if the equity approach for kids in any way differs from the equity approach for adults. Thank you.
Thanks. I can start on that. We definitely feel the equity approach for kids is similar to the adults, but at even higher levels. And because a lot of people are willing to get vaccinated themselves, but they're worried about their kids. And that's so understandable. Like every parent, like I'm a parent, I'm like, oh my gosh, you're always worried about what you're putting in your kids' bodies, right? So that's super understandable. For people in higher social vulnerability areas, and also, we've also seen racial ethnic inequities in the vaccine uptake. We know that there needs to be more trust building. There needs to be more access to key messages that would be helpful to answer people's concerns, because, everyone is hearing different things. And I think David has mentioned this many times, that misinformation is actually one of our biggest pandemics as well, on top of the normal pandemic. So what we're trying to do at the Department of Health is to try to make that type of information accessible to people, especially community health workers, community organizations, people in their own communities who can then share that as a trusted voice to the community. I know we can do more. We're trying to do more. We have a Better Together program. I can put the link to the program in the chat. But the Better Together program is money that the DOH has set aside for communities to do their own outreach, to share information with the communities. We know this is a long haul because we can't undo all the years of racism, all the years of not equitable access to healthcare, but we're trying our best right now to say, how can we as a community, Department of Health, working with community organizations, with different people to kind of say, yes, we're here for you right now. We want you, if you have questions, we want you to ask us questions. And we have a whole bunch of different educational materials for people to use as well. So that's the way we've been approaching it, is to say, we know right now disproportionately for 12 to 15-year-old vaccinations, our disparity on Hispanic, Latino vaccinations is huge. It's like 35%. Sorry, my numbers, I can share you the exact number, but it's much less than the other kids. So we know we'll probably see the same thing for 5 to 11. So that's why we're doing a lot of outreach. We're also doing a set of surveys with University of New Mexico with Dr. Gabe Sanchez. He's actually reaching out to different groups right now as a survey to see if we can utilize some of those key messages of what parents say. Is it evening hours that'll be better for people? Weekend hours? Would they rather have it at their school or at community organizations? So we're hopefully gathering all that data right now for the next few weeks, and then be able to use that. And also any community input, that's what we also want, right? Tell us where you want the vaccine. We're building that up so we can reach the people who need it the most. So thank you for asking that question, Julia.
Yeah, Julia, thanks for giving me the opportunity to show my favorite slide that, as you know, I do every single time. And this is just a reminder, this is people who live in high income census tracts. We're less than 5% of people in the neighborhood, if you will, in that large neighborhood are below the federal poverty limit versus people where 40% or more are. And the numbers and the difference was more striking, but basically what this says is you have a 14.9% chance of having COVID since the beginning of the pandemic if you live in a district with a lot of poor, low-income people, and only a 7.4% chance in a high rent district, if you will. And so twice the chances. And then if you take that and multiply it by the fact that for some people in New Mexico who live in poverty, which is the highest in the nation for people over 60, they're not 2 or 3 all in. That sort of emphasizes the challenge we face in our state. I do want to also commend Dr. Perron, who right out of the gate with the vaccine effort, specifically targeted high social vulnerability index communities to ensure that we were making higher than normal efforts to reach highly vulnerable communities and to really build equity into the state, at least for the vaccination. So Laura, that's been a great effort, and we really appreciate the work you've done on that. And thanks for the great question, Julia.
Great, thanks everybody. Next we'll turn to Gabrielle Burkhart, followed by Michaela Helion, followed by Dan Boyd. Gabrielle, you are unmuted.
Okay, thanks for taking my question. Gabrielle Burkhart with KRQE here. I had a question, Dr. Grace, you mentioned meeting with the modeling team. When might health officials anticipate that our booster shots will start to make a difference in or significantly impact, hopefully lower, our daily COVID case counts?
Yeah, it's a great question. And I hadn't thought of it, so I especially like questions that I didn't think of before. I probably should have. First, I think I'm glad you asked the question the way you did, because we're still getting good benefit from the original vaccine when it comes to hospitalizations and deaths, but we are seeing 20% of our cases now in vaccinated individuals. So I would say 2 weeks after the vaccine for each person. So every time a New Mexican gets vaccinated, that immunity kind of gets back into gear 2 weeks later. So then the question is, well, what percent of people do we have to see get a booster shot to see a downtrend in cases, and we don't know. If I had the opportunity to vaccinate an additional, let's just say 500,000 people of my choice, I would put all those shots in unvaccinated people's arms first before the boosters. So again, the primary and most effective strategy is vaccinate the unvaccinated. But apart from that, I think higher risk groups, older people, we're seeing medical professionals line up very, very quickly for the booster shots. There's not a lot of hesitation there. When I went and got mine, the place was really packed. It was the most crowded place I've been in, and they did a good job spacing people out, but I hadn't seen that many people in one place in a really, really long time. So I think, again, at an individual level, 2 weeks. On a population level, I think the more people that get a booster, the quicker we'll see the effect. But at the end of the day, the more people who decide to get a primary vaccine, that's what's going to help us right now in our hospital crisis, in our ICU crisis, and in the fact that we're seeing a much higher and frankly unnecessary number of deaths compared to where we were before.
Thank you, Dr. Scrace. So next, I'll ask a question on behalf of Michaela Elian, who I believe she says UNM. I believe she's with the UNM Newsport and is a student journalist there. Her question is, do you anticipate that the vaccination of children will slow the spread of COVID-19?
Yes. Hi, we're from UNM too, me and David. I mean, before. So thanks for being a student reporter. So yes, we do think that it will stop the spread of the, help to stop the spread, primarily because it's a group that's been unvaccinated. So you're vaccinated a new group of unvaccinated people, which automatically prevents more spread of the illness. So, yeah, we do hope that will show, and Christine's team will be watching that to see that we're actually preventing more of the spread. It really prevents the spread to older people too as well. People live in families, and those kids, when you get, COVID, they could spread it to older people. So yeah, it's a really good question. Thanks for asking.
Christine, do you want to provide any epidemiologic perspective or compare this to influenza and what we know about vaccinating kids there?
Yeah, I just want to say that vaccinating children is going to be really important, not only to protect their personal health, but as Dr. Parahona already said, to help us stem onward transmission of this virus and help us decrease our current case rates. So absolutely great question. I would say about currently 23% of our cases are among children. So absolutely, I think vaccination of that group will have a big impact.
Thanks, everybody. All right, next.
Yeah, and I know that, Matt, just one quick comment, and I've lost my internet a couple of times, and I really apologize if Christine already mentioned this earlier, but I think all of us tend to think that kids, they get COVID, they spread COVID, but they don't really go to the hospital very much, and thankfully we've had a low number of deaths. And when we have had deaths up until recently, they've been chronically ill kids with lots of medical problems. But we did have a recent death a couple weeks ago. Did you mention this already, Christine, of a 10 who presented to the emergency room with advanced COVID pneumonia? We're still getting the medical records on that. We don't have a final report, but it's a chilling and extremely tragic and sad reminder that children, healthy children, aren't immune from severe COVID and even death. And those cases have been seen around the country, quite sporadic. But when we get one within the boundaries of our state, I think it's a wake-up call to parents, in addition, who are sort of mulling over whether I get my kid vaccinated or not. There can be a real downside to not getting your child vaccinated. Thank you.
Yeah,
Thanks,
I
Doc.
mean, just want to add that according to the CDC, about 600 children have died in the whole United States. And so that's super sad. So those kids.
Thanks, everybody. Next, we'll turn to Dan Boyd, followed by Lisa Knudsen. I hope I'm pronouncing your name correctly. Followed by Scott Weiland. Dan, you are unmuted.
Hi, good afternoon. Thanks as always for the opportunity. Dan Boyd with the Albuquerque Journal. I wanted to follow up. I know that this idea of a magic number or kind of a target for vaccination is kind of an elusive figure. Governor Lujan Grisham did say yesterday during a news conference that 85% is kind of the target that she was looking at. I was wondering if you could say whether there's been some discussion internally for the modeling team about that number, or kind of, if that level might provide some decreased spread.
Laura, do you want to take a shot at that one? I think, Dan, we have kind of dropped the predictions about herd immunity, if you will. I'm all for getting to 85% because that's how I'm going to keep inching up. So I'm real pleased with that. But I don't think there's a magic number. And I think all the discussion we had earlier about this significant increase in cases with Delta and even in vaccinated people sort of calls into question the whole herd immunity idea. I think I kind of switched over to more of the influenza model where we're going to see this virus mutate and change, and probably our vaccination strategy over time will have to chase those mutations and changes in the virus. And so the more, any number, any targeted number of people vaccinated that's higher than where we are now, I fully support, and of course support the governor in that. But I've also worked with the governor for a long time, and I guarantee you, if when we get to 85% and you ask her what the target is, her answer will not be 85%.
Yeah, I think, and I also think also what Christine was sharing as well is that it's also our behaviors. The more people are unvaccinated, the more opportunities this COVID can mutate. So I think that's also how we as a community respond to getting vaccinated. I also want to point out the equity issue as well. We as a healthcare system also continue to, especially at the DOH, continue to think about how are we reaching those most vulnerable populations, that there is a gap, right? Even though we're over 70% vaccinated, there's groups that aren't 70% vaccinated. So how are we reaching out to people in high social vulnerability areas and also certain racial ethnic groups? So I think it's a long-term process of how we can keep on building trust, reaching out to people who aren't vaccinated, because the more pockets we have, the more COVID we'll have in those pockets of people who aren't vaccinated. So I'm not sure what the number is, but the more is better, right?
Yeah, I would just add to that. I think if Delta has taught us anything, and if this global pandemic has taught us anything, it is a major lesson in humility over what we know and what we don't know. And so I would say, I don't know if there is a number, but I know that it's absolutely essential to get vaccinated for your own personal health, but also to protect those around you that may be quite vulnerable to this virus.
Thanks so much, everyone. Next, we'll turn to Lisa Knudsen, followed by Scott Weiland, followed by Chris McKee. Lisa, you are unmuted.
Hi, this is Lisa Knudsen. I'm with Source New Mexico, and I just want to thank you all for the opportunity to ask this question. Dr. Grace, you may remember that about a month ago, I asked you a question about first responders, EMTs, and paramedics. And it's my understanding that at this time, they have not been included in the vaccine mandate for healthcare workers. And I was wondering if you could expand a little bit on that, explaining why they haven't been included. That's the question.
Yeah, it's a great question, and you did ask it before, I remember it, and it was a hard question then, and I gotta say it ain't gotten any easier in the past month. We do know that some very, very large groups of first responders, and particularly ambulance crews that work for large delivery systems. For example, Albuquerque Ambulance is a subsidiary of Presbyterian, and so they all fell under the vaccine requirement as enforced by Pres. We do have a bit of a shortage, and we're, right now we talk mainly about ICU beds, but we also have a critical shortage of transport, and we continue to talk with those groups. They've traditionally been more conservative about issues related to personal freedoms versus societal public health good issues. And so all I can say is we're continuing those conversations. I think the governor actually started with a mandate for healthcare workers within facilities. We haven't expanded that mandate beyond that for an absolute vaccination mandate. And so we're about where we were today. I think I would encourage you though to not just ask me, talk to some of the first responder groups, firemen, MT group, and see what their concerns are. And I don't want to express their points of view on their behalf, but I think we're having reasonable conversations with them. And the individual delivery systems requirements related to that. But the straight answer to your question is no, there is not anything that requires 100% of all first responders to be vaccinated at the present time.
Can you guys hear me still?
Yes, ma'am.
Okay, great. So I have talked to some of the first responders in the city of Albuquerque, and they're saying that of all 679 firefighters, all of them are trained as either EMTs and paramedics, and 85 to 90% of their calls are medical calls. So I guess my follow-up question is, why aren't they considered healthcare workers in the sense that they do occasionally transport into hospitals?
Yeah, I think the definition in the public health order is that they're defined clearly which healthcare workers were included, and it was those in hospitals and congregate living facilities. For example, doctors in a private practice and their staff did not fall under the public health order. Doctors who work at UNM or Press or Loveless generally did fall under the public health order, because those organizations are big enough that they just decided, you know what, we're just going to vaccinate everybody and do it that way. So it's not that the public health order doesn't consider them healthcare workers, it's just that it doesn't, at this point in time when the governor made that decision, include various groups of healthcare workers, not just EMTs and firefighters and police officers.
Thanks, everybody. Next, we'll turn to Scott Weiland, followed by Chris McKee. And that's all the hands I see at this time. I've put down your hand if you had it up earlier and asked a question. So if you'd like to now get in line again, by all means, feel free to raise a hand and we'll come back around. Scott, you are unmuted.
Well, thanks for taking the questions. So I will say the question that I sent or emailed earlier, and that is, any idea why New Mexico has a higher infection rate than states that have lower vaccination rates and also don't have mandated precautions, such as Mississippi and South Dakota? Just the New York tracker shows that New Mexico is above states that have fewer precautions and restrictions and vaccinations.
Yeah, and it's a great question, Scott. We kind of touched on it a little bit. I gave you a shout out for your good question earlier. I appreciate you sending the link in advance to the New York Times, and let me drop that in the
you did cut out a little bit
for everybody.
Maybe
Oh, sorry. No, it could be me. I'm having internet troubles today. But thanks for the link. I put it in the chat for everybody. We talked about this at some length. The answer is we don't know. We wish we knew more. We think New Mexico was leading the country in vaccination initially. So we would be leading the country in waning immunity in theory, in August timeframe when, those of us who got fully vaccinated in January and February may be losing some of our immunity. The boosters will help with that. The Delta variant certainly is a much more potent virus and more effective in finding pockets of people. I think there are unique characteristics about our population, including a much, much higher number and percentage of low-income people than in other states. And we know that those low-income neighbors and friends of ours are have an attack rate of twice that of those who live in high-income neighborhoods, and they have a hospitalization rate 2.5 times higher and a death rate 2.5 times higher. So those are three of probably a number of factors that are all interacting together. I mentioned earlier the modeling team had spent, kind of almost all of their meeting on Tuesday trying to wrestle with and see if we could tease an answer out. And I don't think we have a good answer. Plus, this is cyclic and every state has its ups and downs. And so we will, if we're having one of our ups while someone else is having one of their downs, then we'll see what we're seeing today. But I think the real answer is we don't know. We have lots of theories, and we're hoping as this evolves, we'll get more data to have a better understanding of where we're going. For my money, I think the combination of being so efficient in getting everyone vaccinated right away and perhaps waning in immunity that goes with that, combined with the Delta variant of this virus that's been so infectious, are two of the driving factors overlaid upon the socioeconomic status of our state and the fact that we have the highest social vulnerability index in America would be my three things if I were going to pick that were the main drivers, but we won't have the data to know that for quite some time. I don't know. Good question though. Laura, Christine, would you substitute one of my top three for something else or agree, or what do you think?
No, I would say to unpack this, it's really complicated. And, first of all, you have to look at, how much testing is being done. So how many cases are actually being identified? There's a real difference from place to place on the actual testing rates. And so it's really difficult to know the true burden of disease without significantly high testing levels. The other thing I would say is it was clear that there were areas of the country that were really vulnerable to Delta, and they were hit really hard with high levels of hospitalizations and deaths. And so I think there is a correlation clearly between vaccination and your level of vulnerability to severe illness and death. So I think those are two other things to think about. But I think when you want to compare one state to another, you have to. There's many different variables to look at, and many of those are come down to how much information do we know, how might reporting be different, how much testing is being done, and then you can look at that difference in vaccine uptake as well, and zone in on, well, who was it that got sick during the last surge? And it was mainly driven by unvaccinated persons, which is still the same surge that we're living right now.
Just to build on that, I also think, sorry, can you hear me? Just to build on that, I think there's certain pockets, like David was saying, at certain points in time, some places are having a surge and others are not. But there is a good graph from, I think, Kaiser Family Foundation that maybe we can show the next time, that shows the higher vaccinated locations actually have had fewer hospitalizations and deaths. And it's a great graph because you can find New Mexico on there, and New Mexico has a high vaccination rate and over time, much less hospitalization and deaths than other states. So.
All right.
Try to
thanks so
look
much.
for it.
Sorry, Laura. Thanks so much, everybody. Next, we'll turn to Chris McKee, and then we'll go back through the sequence, and we'll go to Susan Bryan, followed by Julia Goldberg. Chris, you are unmuted.
Hey there, thank you very much. This again, Chris McKee over at KRQE News 13. I had a question related to the indoor mask mandate. It is something that often gets talked about here in the newsroom, but I don't get a sense that there have been many discussions about potentially changing the directive in New Mexico. Just based on listening to these press conferences week to week, we're not talking about ending the mask mandate anytime soon. So I did want to just pose the question out there. What might it take for New Mexico to ease up the indoor mask policy? And just to ask the question flat out, have there been any discussions about easing that mandate? I take it no. Thank you.
Chris, thanks for that question. I think the answer to the second question is no. When we show a map of New Mexico that's completely red, that's not a cue for us to think about how to relax our restrictions. And, I'm actually, I think I said this before, I don't think we should have mandates that we wouldn't be willing to do for a year or two until we get to the other side of the pandemic. It's going on and off with things. It's just hard for people. And so I still, in my head, go back to that gating criteria we had for cases per 100,000. And I think that number, if I remember correctly, was 10. So 210 cases a day. And when we got to that level, I think that's when the conversations would begin. But, just when, we've got hospital workers doing double shifts and triple shifts sometimes, very sick New Mexicans, I think we all want to pitch in and do everything we can. And I know you do too, Chris, to protect ourselves and our neighbors and friends and others from getting a virus or transmitting the virus that might result in hospitalization. So no discussions. And I'd be happy to bring it up to the governor and her staff when we get below 210 per day. Christine would probably say when we get below 10 cases per day, but she's an epidemiologist. So,
Well, I think it's
right, Christine?
I think it's much less traumatic to wear a mask than to be hospitalized or die from COVID-19. Though I understand people are tired. People are tired and would like to return to normalcy. The other thing I would add is that this is a CDC recommendation as well, that when the level of community transmission is high, that we add that extra layer of protection by masking when we're indoors.
Thanks, Christine. That's a great point about the CDC. Okay, I think, do you have one more? We're on round 2 now, Matt?
You got it. Yep, we'll turn to Susan Bryan next, followed by Julia Goldberg. And then looks like Michaela would like to ask a question as well. So first to Susan, you are unmuted.
Thanks again. Since we're talking about the public health order, I'm wondering, Dr. Grace, this is kind of a policy question. Do you see New Mexico moving to maybe redefine what fully vaccinated is, since we've been talking about the waning immunity? Could that now require us to also have our booster in order to be fully vaccinated? And the second part of that question is back to first responders. Do you see the governor maybe extending the public health order to include that group of folks? Thanks.
So far, no discussion with the governor about amending the public health order for first responders. I know we've talked about it in the past, but not recently. Didn't come. I was talking with her today about a variety of issues, or yesterday about a variety of issues, and that was not one we discussed. And then the first question was, you cut out a little bit, but it was about the public health order. And Matt, maybe you could rephrase it quickly.
Yes, if there's any discussion about whether the definition of being fully vaccinated
Oh, yeah.
should include boosters.
Yeah, I don't think we're talking about that now. And I don't think we have enough science to redefine what fully vaccinated means. I think New Mexicans who are looking out for themselves and their families, who meet those criteria, like the three of us do, of being 18 and older and having an underlying condition, we all got our boosters. But I don't think there's a plan to really change the rules. I know also Gabriella or somebody sent in some other questions about kids and schools, and are we going to require the vaccine for school admission? Well, no, not anytime soon. I mean, I can see we have a pretty elaborate process at DOH to figure out what vaccines are actually required. And so the earliest we'd even be thinking about that would be, I assume, for the next school year. There are questions about, well, are we going to give only in-person learning to vaccinated kids and, then have everybody else who's unvaccinated do learning at home? Nope, not under consideration. Strong position of the governor and this administration to ensure we get as many kids in school and keep them in school as much as we possibly can, because we know the learning is better. And so, I think we would be super careful about just substituting a new definition for something. If we're going to do something like that, we'd start at the ground up and really reconsider the pros and cons of those kind of decisions. But no discussions about that now. Or today, we're just focused on trying to warn people to be more careful. We want to get some relief for our folks in the hospital so that they can actually, spend some time with their families and go home and be safe and not have to worry so much about carrying the virus to their kids, their parents, or even getting it themselves. Thanks.
Great. And let's turn next to Julia Goldberg. Julia, I believe you're still unmuted. You can go ahead and ask.
Thank you, Matt. Thanks so much. Dr. Space, you had mentioned, 3 minutes ago, but also a bunch of other times, that you don't think there should be any policies that can't sort of last for quite a while, given that COVID seems as though it might last for a while. But in the most recent modeling report, when I looked at it earlier yesterday, I guess, it's mentioned something about that indoor infection control needs to be more stringent this winter than last winter. And at first I thought, I wonder if that means they're going to reinstate like capacity limits at restaurants or crowd limits. But then that seemed as though that might fall under the things we can't do for a long time. So I guess my question is, would any of those things come back? And if not, what would it require to make indoor infection control more stringent than last winter? Thanks.
Yeah, Julia, one of the dynamics of the modeling team is that our modelers get to present their data and their ideas. So that kind of stuff are people's ideas, but not something that we're ratifying. We usually talk about most of them. My idea of more stringent infection control indoors in the winter is like having everyone follow the actual public health orders we have right now. So to me, it's just a higher percentage of people when I go into my big box store to get a little part for some piece of like a plant stand that I'm making, for my house on the weekend, that everyone has a mask on, and like that I don't really, that we don't do the chin protector thing anymore. So I think it's just simple wearing a tight fitting mask when you're indoors, any place outside your home. And to me, more stringent control really just implies a good mask, tight fit, indoors, everybody doing it.
So that's a no, we're not bringing back capacity limits, probably.
Well, I'm not the final policy decision maker. I make recommendations to the governor. I think we're doing everything we can to control this pandemic, but all of us in government, you all as reporters, the public, people are getting tired of this. And I think we just have to find a way that's effective to really battle this virus in the long run. And I don't know what that all is going to mean. It could mean that the boosters start getting adapted, like there's a Delta booster that comes out that we get, or we settle into a yearly pattern of some sort of updated vaccine like we have for influenza with the most common viruses. I just think my advice to the governor has just been let's focus as much as we can on long run solutions to this, which right now are vaccinated, unvaccinated populations, boosters, masks, indoor masking as a mandate. And, I don't know what else everybody out there thinks they can live with, or if there are people out there that think they can't live with anything on the list I just said, but we're trying to find a way to live with this virus until we find a better way to completely eradicate it.
Thank you.
All right, thanks so much. Next, we'll turn to Michaela. And Michaela, good to have you with us. I think this is the first time, so please correct my pronunciation and let us know where you're from and what your question is. Thanks so much. You are unmuted.
Thank you. My name is Michaela Heelan, and I'm from the New Mexico Newsport and UNM. I guess my main question was about you mentioned earlier about testing in schools for students. I would probably guess this, but would it be available for teachers and other staff in the building too, to go get tested if they are feeling ill or other reasons?
Well, that's a great question. And we already have testing available for teachers, staff, and students in the schools. There's requirements for teachers to be tested, particularly the unvaccinated teachers, on a regular basis. But if you're really, really curious about this, you have to mark your calendar and come back next Wednesday at either 2 o'clock or 3 o'clock. You're going to hear a lot more about the in-school testing program. But yes, definitely. It's really interesting. We're going over the data the other day, and it turns out that at the beginning, like if you remember in January when some folks were back in school, we were looking at case rates, teachers had 75% of the infections, a 3-to-1 ratio of teacher infections to kids infections. And now, and I can't remember the exact ratio, but it's at least flipped. There's at least 3 student infections for every teacher infection. And I think that I take that to be strong testimony of the effectiveness of the vaccine. You remember there's a big push to get teachers vaccinated in April. And so, but no, that testing is important. I appreciate you bringing that up. A reminder. The last thing I'll say, it's a technical point, is if that teacher is sick, we don't want them at school. If that staff member is sick, we want them to stay home and get testing at a drive-through site or a safer site. We don't want them bringing the virus to school. So the strategy for sick people, sick staff, students, and teachers is, number one, stay at home no matter what, in terms of don't come to school, and then get that testing in the way that works best for you that same day, if possible. So, but good question. And come back next week for more from Secretary Steinhaus.
Thanks so much. So that, I believe, is the end of the questions or the list of folks who have their hands raised. Chris, you still have your hand raised, but I think that may have been from your previous question. Do you want to ask another question?
Yeah, I just have one more, if you will indulge me. Thank you. Thank you. This is related to holidays. Last year, and I think Thanksgiving fell right in there with the 2-week sort of shutdown because cases were surging, if I remember correctly. And I think it dovetails kind of off of what Julia was asking about, and maybe just broadly the question is, what are you sort of telling New Mexicans about holidays? Should they anticipate any sort of further guidance or instructions, or is it kind of like what you were suggesting, I think, a little bit earlier, Dr. Grace, is that at this point it's really up for everybody to do their part?
One of my colleagues want to take a shot at this one?
You're breaking up a little bit. And I'm sorry, I may not have heard the entire
And I
question.
missed some of the questions, so
Try and ask it again. Can you guys hear me okay right now? Okay.
Yes, sir.
Okay.
no, I can't.
Just very quickly, in recap, holidays were very different last year. There was a surge in cases. Coming back to this year, should we expect rules or changes from the state, or is it kind of incumbent on everyone to sort of make their best decisions and maybe expect a little guidance from the state, but maybe not necessarily the rules on how many people you can gather with and such? Thank you.
Yeah, as I look ahead, I'm thinking it's going to be guidance like it was last time. I think a piece of guidance we haven't trotted out in a long time that I'd recommend that we had last year that people consider seriously is, remember when it was, as long as it was your own household, you didn't have to wear a mask, but if you were mixing multiple households, even in your family, you might want to consider that. Now, nobody's idea of Thanksgiving is sitting around the Thanksgiving table with your extended family, everyone wearing masks or watching football or lifting up your mask or pulling it down to eat. We'd all have gravy soaked and stuffing masks by the end of that exercise. But I think you can expect to hear from us about best practices, cautious practices. The thing I worry about most over the holidays is the air travel part of it. I think air travel's gotten safer, but people should not let their guard down. And I know we got N95 masks off of Amazon. And I've had to take a flight or two this summer to visit family, and I wear that mask, I wear that wrapper. My joke is that I wear the N95 mask, the wraparound eye protection, and then I get 3 rolls of saran wrap and just cover my whole body. But only the saran wrap is a joke. But I think extreme caution with travel, not taking that mask off on the plane or in the airport, and just general good hygiene, and thinking about how you serve the food and those sorts of things to prevent spread. And yeah, we will send something out, but I think we have to find a way.
Oh. Dropped off
I
again.
think we lost Dr. Scrace there because of his internet connection. But I think sounded to me like he was going to echo some of what he'd said before about finding a way to continue in a way that's sustainable over time. And we will, as he said, put out bulletins in advance of the holidays. So now might be a good moment just to give him a second to come back if he's coming back, and give the press a chance to. Oh, sorry, go ahead.
I was just gonna add to that as well, is that say I hope that we should have a platform to provide some holiday tips and safer ways to celebrate the holidays. And I know the specific question I think was related to possible public health orders or et cetera. But I think we're going to be leaning towards sharing guidance and tips, and just want to say celebrating holidays obviously are very important for our mental health, if nothing else. And we want people to celebrate, but we want them to celebrate safely. And so I'm just going to take this opportunity, because I take every opportunity I can, to say the number one way you can make your holidays safer is to get vaccinated. And I'm sure Deputy Secretary Parahone is going to shake her head. So number one way to make those holidays safer is to get vaccinated. You may want to think about if indoors, a well-fitted mask. And I think what some of our, maybe some of those bullets on the modeling slides, what they may be referring to is you can think through the option of masks. And a cloth mask is used for source control, which means you're putting it on to protect others. But then there's other choices of masks where you can start to increase your own protection. So different type of respirator masks, which I believe Secretary Scrace mentioned, and N95. So there's different types of masks where you could increase the level of protection to yourself, and no matter what, ensure that it's well fitting over your face. The other thing is outdoors is safer than indoors. So if it's not freezing out and if there's any way to celebrate outside, and that's why Halloween just seems to be a fantastic or a great holiday where most of it is celebrated outside, and then avoiding crowded places, indoor crowded places, poorly ventilated places. And then you may want to consider getting tested if you're going to be gathering with somebody in the family who's vulnerable. They may be vaccinated, but maybe they're quite vulnerable and have a history of immune suppression or multiple chronic conditions that would make them quite vulnerable to infection. You may want to get tested before gathering. So those are just some quick suggestions, and then I think we're going to probably put something together and get that out. And then Deputy Secretary Petahone, did you want to chime in?
Oh, no, I think that's great to have like some holiday guidance tips. Yeah, that's a great idea.
All right, thanks to you both. Well, I'll just do a last call. Anyone want to raise a hand and ask one final question before we call it a day today? Okay, seeing none, I'll put it back to our two remaining panelists for any final words you'd like to offer.
I guess I'll go first, and I just wanted to say thank you for having me. It's always a pleasure to get the opportunity to share information and share some of our data with all of you. And I would say primarily, this is a hard time. We are all struggling. We would like to put this pandemic behind us and in the past, and unfortunately, we're not there yet. And that's why I had shared some of that global data, just to show that we all continue to struggle with this global pandemic. But we're thrilled that we do have effective countermeasures, such as various treatments that Dr. Scrace talked about, and then certainly vaccination is our number one countermeasure to help mitigate the ongoing spread and impact of this pandemic, and also to keep ourselves safe. So I'll stop there.
Yeah. And yeah, once again, thanks again, yes, as always for having us. And I do think that you guys are the people who are helping to battle the misinformation out there and getting the message out. I know it's a confusing message, so many different kinds of boosters and possibilities, but thanks for hanging in there with us, evolving with us as the information changes and we get more of the science. We're really, trying to get ahead of the COVID. It's so new, it's a Delta, there's different things that come on. And so by having you guys out there and sharing the information, that really helps to build the trust so people can get the vaccine. So thanks again for all you're doing.
Good. And Dr. Scrace, any final words from you? Our other two panelists have offered a couple of closing thoughts already.
I do have a couple of things. One is I want to give a shout out to Michaela Elin, who I believe is the journalism at UNM. People who've worked in healthcare for a really long time. So I'm assuming this is part of your education. We're delighted you joined us today. Please get the word out. To go to UNM, you have to be.
Oh, darn, I think we've lost him again. Well, I'll echo his praise. Michaela, wonderful to have you with us. Hope you'll be part of our regular press corps here at the weekly press conferences. And for everybody, lovely to be with you, and we'll plan to be with you same time or approximately the same time next Wednesday afternoon. And until then, thanks so much. Bye-bye.